Welcome to our next voyage on T-10, the show with 10-minute takes on the future of education and healthcare. I'm your host, Tim Fitzpatrick. On today's voyage, you'll hear from Paul Julius, CEO and co-founder at Thread Health. Paul has been a startup operator for 9 years, having spent time in the physical therapy space at United Health Group, and then as an operations leader at Heartbeat Health, the nation's largest virtual cardiology company. He and his co-founder launched Thread Health in 2021 to deliver virtual care and health education for teens, 20-somethings, and their parents. Thread Health is tying things together to make it easier for teens to speak to doctors and their parents, and to keep them engaged in their care as they make their first healthcare decisions in their lives. Talking to Paul, it makes sense why digital health and text messaging in particular are great delivery mechanisms for engaging and educating this population. Exciting times ahead for teens, parents, and Thread Health. We are ready to go. Please enjoy my conversation with Paul Julius. All right, we are back on T-10. Paul, welcome to the show. It's great to have you.
Thanks for having me, Tim.
Cool. So I would love to have you start out by giving people an idea what you do at Thread Health.
Thread Health. I am the CEO and co-founder of Thread Health. We've been around for about a year and have a team of about 8 doctors.
Amazing. And tell me a bit more about what your focus is. I know you and I had a chance to properly meet and catch up a few weeks ago now. Really excited to have you on because of your particular focus area and the specialty that you and your team are working on.
So Thread Health is focused on adolescent care and seeing patients who are teens. We also work with our parents and teen families, and we do that through text and SMS. So digital health for teens, reducing friction for teens to speak to a doctor about health issues. There are a few companies focused on very specifically teen mental health. Thread Health is focused on physical health of teens. So issues that teens, in a lot of cases really care about. So think things that are common among teens. Teens have 2 to 5 colds per year. 80% of teens have acne. You have flus, stomach aches, and of course you have the big one, which is sexual health. So that's what we're focused on at Thread, is reducing friction for parents, teens, and doctors to connect in the moment and when issues present themselves.
Yeah, it's such a fascinating space, and I've gotten to know and understand a little bit more. Just people, like you said, talking a lot about teen mental health, especially. I know you're about a year old. You started it after the pandemic, but social media, and I'm curious to hear why teens. I love the framing of parents and providers and teens being part of that equation, but why is it important to be talking about healthcare and education, especially in this population?
It's really interesting in teen health. We don't have a learner's permit built for teens and learning about their healthcare.
Well,
so in some ways, that's what we're doing. We're helping teens through their first healthcare decisions. We make our first healthcare decisions as teens. We leave the household maybe later on in life, when we're 18, we go off to college, or we move out of the household. But teens are really the first time we go into a pharmacy, might be the first time that we go to an in-person clinic on our own. So the way healthcare is designed, it's, in pre-pandemic, of course, it was designed on going into physical clinics. And what that means is teens were interfacing with a doctor 2 times a year. And this is, again, where we're making our first healthcare decisions, and we have a lot of questions. So what we do at Thread Health is we increase those amount of touch points in teens' lives as they're figuring things out. So not only can the teen reach out to us, but we can give them those touch points that are so critical to their development. And we can guide teens and their parents through those preteen years, teen years, and then early 20s. So developmentally appropriate healthcare, kind of all along that period of growth.
So I didn't realize how the range is. It seems to me, as someone who doesn't spend a lot of time yeah, I've obviously been in each of those categories myself, but I'm curious, can you maybe, so from preteen to early 20s, just kind of unpack that a little bit more, just to understand what are those ages and what are those settings? Because when I hear that, I think, all right, everything from I'm in grade school and I have a PCP and I'm going once a year, to maybe I need some stuff while I'm in school. But then, of course, you're entering, now you actually have your learner's permit and you're taking yourself to your appointments, and then thinking about college. So what does it look like today? Are you working with patients who are preteen all the way through into college? I'm just curious if you could kind of dive into that a little bit more.
So that age range really defines the period of adolescence. So what healthcare providers and doctors kind of see as the area of adolescence. That is a big age category. It's, 10 to 25 years of age is, over 20% of our population. When you think of commercial health plans and such, it can be actually a higher percentage of a population. And when you think of preteens, maybe a doctor is interfacing with the parent. They're getting worried that they're about to have a teen, and dealing issues with puberty and other questions that parents might have. And then in the area of teens, they kind of end up getting layered into that conversation where the parent is having those conversations with their teens. And then kind of into their 20s, where there's this kind of hard age of consent around 18, where the teen really, or the 19-year-olds, 20-year-olds, they control their own health. They are
Mm-hmm.
the first point where to touch base with their doctor, where it might have been the parent beforehand. And what we're excited about is to maybe increase teens' involvement in their health education over time, and doing that more gradually before they turn 18. So that's where I get to, uh, I talk about the learner's permit and kind of getting
Mm-hmm.
prepared for that, that 18, uh, turning 18.
First of all, thank you for kind of defining adolescence as a category. And as you're talking about all the things that people care about, both parents and clinicians, obviously the adolescents themselves, it makes me think that there's potential to be a lot of stakeholders across different types of care organizations, or individuals who play different roles that might have some relation to health education for the adolescents, for the preteens, for the teens. Is adolescence a specialty? Like, how would you consider? What does that look like? Are there professionals? I think you had mentioned something to me before about this is actually a trained specialty, but how do you think about clinician stakeholders? And then the secondary question, is adolescence a further specialty within medicine?
Yes, it is. And it's been around for a while. It's one of the younger specialties, or subspecialties in healthcare. But it's been around for years. My co-founder is Dr. Hina Talib. She's an adolescent medicine specialist, and she was a director of the Adolescent Medicine Fellowship at Montefiore here in New York. And uh, there are about 500 adolescent medicine specialists across the country, and they are mostly embedded in health systems, embedded in hospitals, and it's something that's been clinically driven. That's a need in these health systems. So what we're doing is, in some ways, we're making that more universal, and allowing access to our team. We have 8 doctors on our team, 6 of which are adolescent medicine specialists. And that specialty, it's a 3-year fellowship, and where they just spend their whole time talking to teens. So when you think of you know, a a typical pediatric clinic, maybe 1/10, maybe 1/20th of the patients being seen are teens. So that's a lot of experience. Hospital setting, uh, seeing teens day in and day out for 3 years, you really get an understanding of the issues of teens, but also the soft skills that it takes to kind of navigate those different stakeholders, that principal agent relationship between the parent and the teen, and then really communicating back and forth. What we're really excited about at Thread is that text and SMS is just a great way, and asynchronous communication is a great way to break down that complicated system. So in a doctor's office, you have this kind of limbo where the teen is moving in and out of the doctor's office, where using asynchronous communication, text, you can at least tee up a lot of the conversations that you're having between the different parties, and then that leads to everybody being more understanding more about the problem at hand.
I'm sure. No, I love to hear that there's such an opportunity, especially I would imagine with teens, with this demographic who is even more receptive. We've seen text, SMS have so much success in other areas in subspecialties in healthcare. I have to imagine that it's even more pronounced perhaps in adolescents and parents.
Teens are interesting. They're finding a lot of their health information that they have. For me, it was, I think my parents gave me a puberty book when I was younger.
Same here.
But a lot of teens now are finding information about their own health online and using TikTok. TikTok is actually, it's very searchable. So it makes a lot of sense that teens would go to a social media app that they're using a lot. Again, when we were thinking about Thread Health, we were trying to reduce that friction. So when a teen has like an important issue or even a small issue, they might think that it's a good idea to talk to a doctor and make that really easy for them. It's really interesting when you look at some of the polls around teen health and children's health. There's the Mott poll out of the University of Michigan is really prominent. A lot of parents don't think that their teens are capable or willing to ask questions directly of their doctor. Only in some cases even 10%. So what we're doing and hoping over time is that teens will get more involved in their own healthcare, and hopefully we'll have more data where we'll be able to show that teens are, they start out maybe participating in a portion of their conversation, but that portion increases over time, which again shows more involvement in their own health and controlling their own health.
Yeah, even a lot of my friends seem to be going to TikTok to figure out and learn about their health, which I always, I wish they would ask me first and maybe I could redirect them, but I have heard it's a killer search engine. So I'm blown away that you have over 1% of adolescent specialists in the country, if my rough math is correct.
We're a pretty large adolescent practice when it comes to a pretty big portion of our population again. So really proud of our team and moving things online.
Yeah, it's incredible. And I have to ask, because I have nieces and nephews who are kind of quickly going to be in the Thread Health range. Where are you today? Where are the patients you're supporting, or the providers you're supporting at this point?
We've launched in New York. We'll be expanding into kind of the tri-state area. We're also looking at a short time frame launching in California, maybe Texas, and then Florida.
Excellent. Well, I'm incredibly excited, Paul, to follow your journey with Thread Health. Thank you for taking us through this subspecialty. It's something new for us. I love the idea of a health education learner's permit, something we don't have that we need for teens and preteens and adolescents. Where can people get a hold of you and contact you after the show?
Contact@threadhealth.com, or you can reach out to me directly at paul@threadhealth.com. threadhealth.com.
Excellent. And I know you have social media presence. I've talked to you back and forth on Twitter. Are you active on other social platforms where people can find you?
So my co-founder is at Teen Health Doc on Instagram, and we are building our Instagram channel. So health_thread for Instagram. Wasn't able to get the health thread health tag.
Well, we'll make sure that's all in the notes so people know exactly where to find it and can go to it directly, and we'll make people's lives easier on finding your Instagram feed, and they can learn from you. Paul, thank you for coming on the show. It's really good to see you.
Thanks, Tim.